am Dr. Lewis with Spinal Health and Nutrition. Today we're going to talk about a chronic condition here that can be very painful and last for quite some time. It's called fibromyalgia. Fibromyalgia. What is fibromyalgia? It's a chronic condition that causes pain and joint stiffness all over the body. It can also lead to lack of sleep and psychological problems, mood swings, because, of course, the amount of pain that a person is experiencing. Okay. Now, this condition can actually amplify the sensation based on how the brain and spinal cord process information regarding the pain signals. Okay, so I'm going to elaborate on that. What I have here is the spine, and these are the nerves and the spinal cord. In reality, the nerves are very long. As they branch out, they split into two sections here. You got your sensory nerve, and you also have your motor nerve. The sensory nerve pretty much receives information about what's going on. Especially, for example, if you put your hand on a hot stove, that hot stove will activate the sensory nerve, so that way you can detect temperature or pressure. Once that sensory nerve receives information, it sends it to the brain, and the brain begins to process it as far as interpreting what's going on. When the brain interprets what's going on, it sends information through the motor nerve, and it's the motor nerve that causes us to quickly withdraw our hand back from the hot stove because it's activating those muscles that are being affected due to that scorching heat. Okay, so that's what's going on with fibromyalgia in different aspects. Okay, the causes of it. The cause is due to the brain receptors. When the brain pain receptors receives a good sort of memory regarding the pain, it becomes overstimulated with pain signals, painful signals, and also non-painful signals. Okay, going back to that hot stove again. All right. So when someone put their hand on that hot stove, the brain becomes overstimulated. Okay. And especially if someone does not have their hand on the hot stove, but the brain can remember the feeling of it, it's still going to be activated. All right. So this is a very serious condition here. All right. The other causes of it is going to be family history, genetic factors here. Okay. So it's very important to see your doctor, losing that you're having sporadic pain all over the place, all over your spine, all over your neck area, certain parts of your upper or lower extremities, so that the doctor can do a thorough history and do a physical exam to run some tests to actually see what's going on. Okay. There are some genetic mutations that can actually cause this. Now, there's still research out there on how to detect these genetic mutations. They're still working on blood tests so they can actually see the actual biomarkers or genetic mutations that may indicate fibromyalgia. The first one is called 5-HTLPR. That's actually a serotonin transmitter that produces pain causing fibromyalgia. Okay. The other one is called H5TR2A. It's a polymorphin associated with fibromyalgia that can also cause some depressive symptoms there. All right. And so there's still some research out there on how they're going to detect this. But once they come up with some tests to see these biomarkers, that's very important. Okay. If someone is experiencing symptoms, encourage them to see a doctor. Have them run some tests. If those biomarkers come up, then that's an indication of fibromyalgia. Another thing are infections. Certain infections can actually trigger this. For one is hepatitis C, HIV, Lyme disease, pneumonia. That can also trigger it. Okay, and also past physical and emotional events. Okay, like I said, the brain has a tendency to remember those past physical and emotional events. All right. For example, someone has traumatic memories of being abused or severe car accident. Their brain is going to remember that. Once that brain remembers that, it's going to start stimulating those pain receptors. That person is going to feel pain all over again. Okay. As far as gender, studies have shown that most females are affected by this. due to the high fluctuations of hormones, okay? And the age range is between 35 and 40, all right? Now, let's talk about these treatments here. Chiropractic care is one of the good treatments for it, okay? Basically, what we do as chiropractors, we pretty much work on the spine by applying the chiropractic adjustment. That's going to help relieve pressure, all those painful areas, to help reduce pain due to this condition, the fibromyalgia, okay? The patient's not going to feel better the first day. So it may take a couple of visits, okay? With some soft tissue work. We follow up by doing some trigger point work with a massager or massage gun. They actually get those muscles to relax, because with fibromyalgia, those muscles are overstimulated. It gets spasms all over the body, right? Another thing is exercise is very important, okay? With fibromyalgia, it increases someone's adrenaline levels, okay, causing them to feel depressed. But when they exercise, there's a molecule called endorphins that's going to increase. And those endorphins is a pain fighting molecule, and it will also help reduce pain and also depressive symptoms. Of course, someone has this condition, they're going to be depressed. Who wants to live their life every day in pain with limited range of motion? And exercise will help increase those endorphins, and it will also help increase their range of motion on those painful joints. There are some medications out there for this condition. Okay, you have your muscle relaxers, you have your ibuprofen, you also have your antidepressants. Okay, now I'm not knocking these medications. Those medications can be very strong, and it can come with some side effects. So if you know someone who is tired of dealing with the side effects, I know the medications can cause most people to feel drowsy, lack of sleep, or sleeping too long. Encourage them to go seek some alternative medicine, seeing a chiropractor, physical therapy. Okay, someone who knows how to help work out those areas to relieve pressure off the spine, pressure off those extremities. That is very painful. Okay, and give them some exercises to do to help increase range of motion, get those endorphin molecules up, which is a pain fighting chemical in our body. All right, so there are some things out there. There is actually another alternative out there that will be a good solution to this problem, okay? And the sooner the better. We don't want to wait too long, because the longer we wait for this condition, taking medications, the longer it's going to take for someone to receive results from this regular chiropractic care, all right? We can do this. I'm Dr. Lewis. Please like, subscribe to our YouTube channel, and remember, your health is your greatest